Pharmacists have an important role to play around antibiotic awareness and the impact of colds and flu from a symptom point of view, that they will be bothersome and they will take quite a few days, if not 2 or 3 weeks, to get better. And by emphasising the fact that it's a viral infection and antibiotics just won't work, the individual can be discouraged from visiting their GP and really focusing on their symptom control, rest, plenty of fluids, healthy lifestyle in order to get better quickly. The pharmacist can also help by identifying when it is important for somebody to go to the GP. And they might be symptoms such as particularly high temperature over longer than perhaps 3 days, coughing up blood and green phlegm that's associated with chest pain and difficulty with breathing. So those kind of symptoms would indicate perhaps a GP referral, but otherwise antibiotics won't make a difference. Pharmacists can work with their local GPs to promote antibiotic awareness and when it's most appropriate to have an antibiotic and when it's not. And of course, they can help when the patient comes in for their antibiotic to make sure that they take their medication appropriately and for the right duration of treatment. And if a patient's been advised to delay taking antibiotics, the pharmacist can reassure that individual and help them navigate their way through when the symptoms might be bad enough or not to decide a course of action. And there are some patients who the pharmacist will have regular interaction with, such as those that suffer from COPD, for which an antibiotic is part of their self-care plan should they get an exacerbation. And again, the pharmacist can support the individual as to when to know when to take it. Pharmacists should make themselves familiar with the local guidelines around antibiotic prescribing and to work with their GP to identify if there's a way that they can work together to make sure that those guidelines are implemented.